Hello, my name is Olatokunbo Akinde, and this is the client presentation and treatment plan video. My client is a 48-year-old male black veteran, and the reason for the treatment is because it was diagnosed of depression, panic attacks, and PTSD, which is also known as post-traumatic stress disorder. In terms of socialization, my client has very limited socialization. He lost his parents immediately came back from Iraq. Both his mom and dad passed away in an accident. They had an accident and they died. And his only surviving sister stays in Texas with her family, and she's not seen him since they actually buried their parents. And he's actually currently married with 2 kids, and his marriage is on the verge of divorce because of certain situation that's been occurring since he returned from the war. Also, he has very limited friends, and this is because the friends he had before he was deployed, in his mind, no longer his friends because they do not share the same ideas and ideologies about life. They're walking different paths now, so he's no longer friends with them. And he did have friends whilst he was in the military. However, because they do live in different states, he has limited access to them. He does call them on the phone, but their contact is very limited, and because of his condition, he has no job. So he has no friends at work or anybody to share anything with. So his socialization skills are very, very limited. The presence of his physical health problem can be seen in terms of his loss of limbs. During the war in Iraq, he lost his limbs, and that was why he came home. And he has a history of substance abuse. He is a very heavy drinker. He drinks a lot and he smokes a lot, and he uses cocaine. In terms of his behavioral health treatment, because he was diagnosed of PTSD and depression and anxiety disorder, he was actually prescribed some medications to help him deal with the symptoms that he was diagnosed of. My client's current situation is that he resides in Chicago, Illinois. He's currently married and he has 2 kids, and he spends most of his time in the house drinking and smoking, and sometimes he plays his guitar, which he used to love doing, but he rarely does it these days. The presenting problem in my client is the major one is the loss of his limbs. The loss of his limbs led to his depression, and in him not being able to play the role he was playing before he deployed, it has affected him and made him feel like he's not useful to the family and he's not useful to himself. And also, he has excessive nightmares. He dreams about the war, and which has caused him a lot of anxiety disorder, and it's made him have a sleep disorder as well. And also, another challenge that my client has been going through is how to integrate back into the civilian life, the life he knew before he went to deployment, not taking into consideration like the person that left for deployment is different from the person that is back from deployment, and also the fact that is using cocaine and drinks heavily has affected his health, and has reduced the strength and the energy he has to do any other thing. I conducted a mental status examination on my clients on the 3rd of November of 2016, and during my mental examination status, Mr. Duke is a 48-year-old black male veteran. He was dressed in a black t-shirt, jeans, and black tennis shoes. He was seated on a wheelchair with an empty look on his face, staring at nothing throughout the interview. His speech volume at the beginning of the interview is calm, then aggressive, and then calm. His affect is hostile and irritable with an angry and depressed mood. His flow of thoughts are coherent, and thought content reveals suppressed feelings of anger and hallucinations that are self-demeaning. He admits to suicidal thoughts and failed attempts. His orientation is good, aware of current date, place, and person, and memory is very good. Although my client shows and acknowledges illness and the need for help, he was resistant to submit to help initially, but eventually agreed to submit to help. My client's differential diagnosis could be seen in terms of depression and having problem with the use of alcohol, cocaine, and being a chain smoker, which is having problem with substance use. And it could also be seen in terms of anxiety disorder, which is coupled with sleeping disorder. And also he was re-experiencing traumatic events of the war, which made him have nightmares and not being able to sleep. And also he could be seen in terms of PTSD, panic disorder, depression, and recurrent unproven panic attacks. My client, the strengths I've seen in my client is the fact that he's a military man. He's been a military man, in my view, is a strength that could help him to overcome the depression and the anxiety disorder. This is because the military has a culture of being very strong. Because they are saddled with a lot of responsibility of watching each other's back, and they know that if I do not watch this person's back, something might happen to this person, and that something might mean that person might lose their life. So because they are saddled with that responsibility of keeping this a particular person's life, they take it very seriously, and in taking it very seriously, they would do anything to achieve their aim of keeping that person alive. So I could see this as a strength that can be tapped in terms of my client, using his military responsibility and his military training to help him see the strength and resilience in him. However, one challenge that I can see in that is that the fact that military men do not like to show their weakness. They do not like to ask people for help, because asking people for help in their view is like they're weak, and this could mean a challenge in trying to make my client open up to ask for help, and letting him open up to see how certain things that I might do might be beneficial for him and his family in the long run. Another strength that I could see in my client is the willingness that he wants things to change, the willingness that he wants things to go back to the way they were before his deployment, the willingness that he wants to have a say in his family, the willingness that he wants to make a difference and be a part of the change in his family. This could, in my view, could be a strength that we could use to help my client to overcome the depression and the panic attacks and anxiety attacks he has. The goal here is to help my client, if not go back to the way things were before he was deployed, but to go back to a place where he's comfortable and his family are comfortable living with each other, and there's communication amongst them, and there's peace and calmness in the family. Because trying to go back to the way things were before the deployment might be very, very difficult, because now we're talking about a new person coming back from the war who is different from the person that was before. So trying to go back to how things were before might actually pose another challenge. So the goal here is to help find a common ground for both my client and his family, so that they can actually have the tranquility in the family for the kids and my client and the spouse, as the case may be. Another goal that we need to achieve here is also to create employment for my client, to be able to take care of his responsibilities. Initially, one of the problems that my client told me about that he was facing was the fact that he felt useless, and he felt like he couldn't take care of his responsibilities, which were his children and his spouse. So being able to find resources to help my clients to get a better job, or to help my clients get a job so that he'll be able to take care of his responsibilities, is another goal that we aim to achieve with this presentation. Also, him looking at himself as a liability is another challenge that my client wanted to overcome. So being able to get a job for him, being able to allow him see himself as part of the family, as part of the family who's responsible for taking care of what he needs to take care will help him to overcome the depression that he is facing, or the anxiety that he's facing. Also, being able to have a job and associating and socializing with people would also help him to be able to deal with whatever stress he's going through, and be able to cope with the reintegrating back into civilian life. Another goal that we aim to achieve is for my client to be able to make the military proud. As a military man, they do not like to fail because they have that strength and resilience in them. They believe that they are very strong and should be able to overcome any problems that might be or that might come their way. So him not be finding it very difficult to integrate back into the civilian life has posed a challenge for him, and him being depressed and not being able to overcome this obstacle to him in his mind makes him feel like he let the military down. So helping him to overcome this challenge and to overcome this obstacle will help him to see that he is a better man for it, and also make the military proud and not see himself as a weak man. There are various types of interventions that might be useful, that we might use for my clients in this situation. We have the individual therapy, where there's an individual therapy between the therapist and my client. There's the CBT therapy, which is the cognitive behavioral therapy, and there are other form of therapy that could also be employed, which is the sleep hygiene to help with the sleeping disorder and the anxiety disorder. And this sleep hygiene helps to create avenues where my clients will not find it difficult to sleep, and it could be in terms of decreasing the stimulation before bed, avoiding awake activities that could keep him awake at night, and also dimming the light before sleeping, being like a tranquilized atmosphere. But this might not be very encouraging for my client who is going through who is having nightmares and going through post-traumatic stress disorder, because they might have flashbacks about the war, which in some cases might be like a situation of darkness. So you do not want the client to be in darkness. We could also recommend relaxing techniques, which in form of yoga, in form of meditations, and also introduce exercising to my clients. Exercising helps to keep the strength and balance, and gives a positive outlook on things, because when you have the strength and you have the energy, you're ready to go, you're ready to work. You do not depression makes you feel very weak, and it makes you feel like I do not want to do anything or for the rest of the day. But when you are exercising, you're stimulating your hormones, and which energizes you. It energizes the brain, and it helps releases most of the tension in the body. And also we could also recommend emotional release. Emotional release could be done through playing musical instruments. It could be done through singing. It could be done through drawing. These are some things, some therapy and some form of intervention that could actually be introduced to my clients. However, the specific therapy that I would prefer to use to my clients would be the CBT, which is the cognitive behavioral therapy. The cognitive behavioral therapy sees a whole problem and breaks it down to little simpler tasks for the client to be able to handle. So CBT allows the client to see the problem, and then it allows the client to think about the problem, and then have emotions about the problem, and decide what physical feelings he or she wants to have about the problem. And then it allows the client to see the problem, to have actions before the problem, the actions the client took before the problem, the actions the client took during the problem, and the actions the client is going to take after the problem. So in this situation, my client is going to be given simpler tasks like homework, and for him to go back home and work on, and then come back, and then we'll talk about it and see where or how we can make changes and adjustments to what my clients can do to better the situation and the circumstances going through. Another thing I would like to recommend is the fact that my client loves to play guitar. He loved to play guitar before he went for deployment, and after he came back from deployment, he did not really play the guitar as he was playing it, but he seldom plays it. So in this situation, I am going to recommend that he uses the guitar as an emotional, a form of emotional release, to release whatever anger is inside of him, and play songs that will make him feel at ease with himself, to calm himself down, or in the case where he needs to release tension, to release the tension through the playing of the guitar. Another thing that I would also recommend is exercising. Sitting down and not doing anything, especially when he doesn't have a job to go to, exercising will help him to keep his mind and his brain active, and it will also help him have a positive outlook on life generally. Another recommendation that I would make is or try to do, is to try to see how he can reduce the use of his substance use, how we can reduce smoking and the intake of alcohol, because all this constitutes to health problems, and how we can eat healthy. These are also things that I would recommend he starts to do. Aside from all this therapy, medications were also prescribed to my client by his doctor, and his doctor prescribed my client Elavil. Elavil is a tricyclic antidepressant, and it was prescribed to my client to help improve his mood and feelings, and also relieve anxiety and tension, and help him to sleep better, as well as to increase his energy level. I, as a social worker, had to contact his prescriber, and this is because my client reported to me that he stopped taking his medication. He reported that he stopped taking his medication as a result of the side effects the medications were having on him. He said the medication had made him have blurry eyes, and his visions were blurry, and he gained a lot excessive weight, and he also had sexual problems. His sexual problems were one of the reasons why he and his wife were having problems, aside from his depression, and that was why that was the major reason he told me why he stopped taking the medication. And the reason why I called or contacted the prescriber was because I wanted the prescriber to see my client again and see if there was any other medication or any other thing that he could prescribe for my client to use, which would not have as much side effects as the Elavil. The prescriber prescribed another medication for my client, and he prescribed a medication called Nadil. And thus far, my client has been using this medication for 2 weeks, and he's not had any side effects, and he's not complained about any such side effects on him. He's been taking the medication when needed, and when he ought to use it, at the time he ought to use it. Thus far, my client has been very cooperative with both the therapeutic sessions, which is the CBT session he goes for, and doing his homework as when needed to be done, and asking questions when he doesn't understand what is needed to be done. And I'd really tell you that there's been days that it's been challenging, but I give my clients the props, because even on those days that it's been challenging, he looks to the positive side and says he can do it. And that is one of the strength that I see in my client. The fact that he knows and he believes in himself that he can do this, and he can make life better for himself and his family. So he's been very, very cooperative with both his therapeutic sessions and his medication, and he's exercising more as well and associating with people. He currently has a volunteering job with an agency that helps veterans to get the resources available to them by the government, and he's really said good things about the agency, and the fact that he's enjoying working with people and interacting with people, and the fact that he's making a huge difference in the life of veterans, and making them not have to go through the same thing that he went through, is a huge success on his part, and is very comforting to him. As of right now, I am very satisfied with the improvement that my client has made, based on my client's reaction and the reaction of his family. And I'd like to recommend that my client stays on this track of treatment for the next 3 months. Thank you so much, and have a good day. Bye.